October is celebrated every year as a breast cancer awareness month. Why are we so much bothered about breast cancer? It is very frequent that 1 in 10 women are affected by breast cancer, at least in their lifetime. In this video, we are going to look into one of the most important topic, that is breast cancer. Why are we so much bothered about breast cancer? Because this is the second most commonest cancer which happens in India, and it is very frequent that 1 in 10 women are affected by breast cancer once, at least in their lifetime. So first, let's go into the basic to understand about a cell. So what happens is, once a cell develops, it matures, it does its function, and then dies. Once a cell dies, it is generally shed from our body. What happens in a cancer is the cell develops and it rapidly multiplies. It sometimes doesn't even reach the maturity. It starts multiplying rapidly and replicates itself multiple times, and also it doesn't die. So when a cell multiplies multiple times and then it doesn't die, there is a kind of tumor which is developing, which also can reach up to a malignancy or a very dangerous form of multiplication. So this is called a cancer. So this can happen with any part of our body. Generally, if it happens in the breast, it is called the breast cancer. When it happens in the breast, it can affect the tissues, it could affect the ducts, it could affect any part of the breast. How do we identify breast cancer, or who are all affected? Is there any risk factor which people have so that they can be careful with breast cancer? Number one, sometimes it runs in the family. If your close mother or aunt or someone in the family is affected by breast cancer, then there is a chance that you will also have a little bit of risk due to it. And sometimes it is due to genetics. That is, if there is a gene called BRCA1 and 2, then there is a chance that you will definitely develop breast cancer in your lifetime. It also can be due to other lifestyle issues like obesity, lot of alcohol intake. Sometimes if a woman never getting pregnant is called nulliparous, and those kind of women have a little bit of risk in developing breast cancer. Young girls who attain puberty less than 12 years of age, there is a bit of risk of breast cancer. So these are random risk factors where sometimes can lead us into breast cancers in our lifetime. Many young girls are unaware about this breast cancer, and this is very, very important that we should create this awareness and spread this awareness to all age groups. So how do we identify or diagnose breast cancer? There are different methods. Number one is self-examination. I'm going to explain deep into how to self-examine and test yourself. And number two is clinical breast examination. That is, a doctor does the examination. Number three is ultrasound, that is breast scan. Number four is mammography. Number five, very rarely, sometimes MRI. So these are different diagnostic modalities which are available. The most simplest is the self-breast examination, and this is very, very important. The young girls or any woman should learn how to do it, and this is the only way that you can detect any changes in your breast in a very, very early stage itself. Breast cancer is something which is completely curable if diagnosed very early, and 5-year prognosis for a breast cancer is very, very good, and survival rate after breast cancer is also very, very good if it is diagnosed in a very early stage. So how do we do this self-breast examination? So every month, I think it is better to test ourselves, and after your period stops, that is after you bleed and stop, that is the right time to do the self-breast examination. Stand in front of the mirror first, and then keep your left hand behind your head, and then with your palm of your right hand, you have to massage the entire breast and see for any lump, any changes in your breast, whether you are able to feel any small lumps or growth in your breast. The other important thing is, look at yourself in front of the mirror. See whether both the breasts are at the same level. Is there any change you are seeing between the breasts? Look at the color of the skin and texture of the skin. Also look at the color of the areola, whether there is any lump or any visible lumps which are seen, and also press your nipple and see for any discharges. It could be a watery discharge, sometimes it could be a bloody discharge. So these are very important things which you have to test for yourself. Also you have to look into your axillary area for any nodes or any lumps there, because in cancer you will also have nodes in your axillary area. Whenever you're doubtful, you have to go and meet the doctor immediately, and the doctor does the same examination for you, and that is called clinical breast examination. If the doctor is doubtful about any lump or any discharge in your breast, she or he might refer you for either a ultrasound, breast ultrasound, or a mammogram. Breast ultrasound is a very simple technique. It's very safe, it is non-invasive, and it can give us to an extent whether there is a lump, or whether the lump is smaller, bigger, or what kind of lump it is. Sometimes your doctor might refer you for a mammogram, and mammogram is an X-ray through which we could see any lump or tissue development in your breast. If there is a doubt, sometimes we might also do a FNAC, that is a biopsy, to confirm the diagnosis. When do you start checking for breast examination? When do we start doing this? Any woman between the age of 20 to 40 years, every 3 years it is better to have a check of your breast with the doctor. And also monthly you have to do your self breast examination. That is really mandatory. If the woman is more than 40 years, I think annual breast check is very important, and if there is any change which is felt, mammogram is definitely needed. If there is more than 25% chance that you will definitely have a breast cancer, I think annual mammogram along with MRI is recommended. Women with family history of breast cancer are at higher risk. Doesn't mean that people without a family history will never get a breast cancer. They also have a risk, so everyone should get their self checked. All lumps which you check for need not be cancerous. 80% of the lumps are normal. There is only 20% chance that these lumps can be a malignant or cancerous change. 90% of the early detected breast cancers are curable. It depends on what stage of the disease you are identifying. Stage 1 and 2, definitely there is a cure. And if you are identifying at stage 3 and 4, definitely it is difficult to cure. Out of 135 women diagnosed with breast cancer, there is one man who can also have cancer. So there is a very minute chance that men can also have breast cancer. So the size of the breast and the cancer is not related. Whatever the size of your breast may be, I think there is a chance for every woman to have breast cancer. Yes, all lumps, as I told you, like 80% of the lumps can be normal, but if there is a lump, there is more chance for cancer diagnosis. But even otherwise, any pain, any discharge from the nipple are also signs and symptoms of cancer. One risk factor doesn't mean that you will definitely get the disease, but definitely you have to be aware of it and examine yourself and test yourself frequently. So breast cancer can be from any of the genetics, that is from your mother and the father. So mother's eye relative if there is a history, or father's eye relative, your aunt or anyone who's got a breast cancer history, I think you should be at risk. I don't think there is a relationship with caffeine, but definitely with alcohol there is a bit of risk. The radiation which you get through mammogram is the safer limit. I don't think doing it annually, that is after 1 year, I don't think there is any added on risk. I think it's quite safe for people to get it done. Right from 1990s, there's a lot of awareness towards breast cancer. October is celebrated every year as a breast cancer awareness month, that is Pink October. And I think after that, there's a lot of early detection, there is self-awareness, and there is a lot of decline in later diagnosis of breast cancer. Nowadays, our treatment modalities are so good that early detection and proper treatment makes it completely curable.